The job description of a midwife centers on providing expert care, support, and guidance to women throughout pregnancy, childbirth, and the postpartum period. Midwives play a vital role in maternal and newborn health, working in hospitals, clinics, birthing centers, and home settings. Their responsibilities extend from prenatal assessments to labor and delivery assistance, and continuing through to postnatal care. As primary caregivers during one of life's most critical phases, midwives blend medical knowledge with emotional support to ensure the health and well-being of both mother and baby. Midwives often serve as the main point of contact for expectant mothers, especially in low-risk pregnancies. They perform physical examinations, monitor fetal development, offer childbirth education, and assist in making informed decisions about birthing options. Whether supporting natural childbirth or working in collaboration with obstetricians for more complex cases, midwives are trained to recognize when additional medical intervention is needed. At its core, the job description of a midwife reflects a deeply compassionate and highly skilled profession that is both medically demanding and emotionally fulfilling. Midwives are advocates for women's reproductive autonomy and guardians of safe, respectful childbirth experiences. Primary responsibilities of a midwife. One of the midwife's core responsibilities is prenatal care. This includes conducting regular checkups to monitor the physical and emotional health of the pregnant woman and the development of the fetus. Midwives measure vital signs, check fetal position and heartbeat, perform screenings, and provide nutritional and lifestyle advice to support a healthy pregnancy. Educating expectant mothers is a key aspect of their role. Midwives offer guidance on topics such as birth plans, pain relief options, breastfeeding, and newborn care. This education empowers women to make informed decisions and feel more confident as they approach labor and delivery. During labor, the midwife is responsible for monitoring both the mother and baby, ensuring that the birth process progresses normally. They provide continuous emotional and physical support, manage pain relief methods such as breathing techniques or warm compresses, and assist in delivering the baby safely. In some settings, midwives may administer medications or perform procedures such as episiotomies, always within the scope of their training and local regulations. After the baby is born, the midwife continues to care for the mother and newborn. This includes checking for postpartum complications, assisting with the initial stages of breastfeeding, monitoring infant health, and offering advice on recovery and newborn care. They also provide emotional support during the often overwhelming postpartum adjustment period. Midwives are also trained to identify potential complications and refer patients to doctors or obstetricians when necessary. They may collaborate with other healthcare professionals in cases of high-risk pregnancies, cesarean deliveries, or medical emergencies. Their ability to balance independent decision-making with interdisciplinary collaboration is essential. Beyond clinical tasks, midwives may be responsible for maintaining accurate medical records, completing documentation for births, and adhering to professional standards and healthcare regulations. They also promote public health by advocating for safe maternity care and supporting reproductive health education in their communities. Halfway through this exploration of their duties, it becomes evident that the job description of a midwife extends far beyond the delivery room. It encompasses preventive care, education, clinical precision, and emotional strength throughout the entire reproductive journey. Essential skills and qualities for the role, empathy and compassion are foundational qualities for a midwife. Childbirth is a highly emotional experience, and midwives must be able to support women with warmth, patience, and understanding throughout both joyful and challenging moments. Communication is another critical skill. Midwives must clearly explain medical information, answer questions, and listen attentively to patients' concerns. They must also convey updates and collaborate effectively with other healthcare professionals. Decision-making under pressure is vital. During labor and delivery, conditions can change quickly. A skilled midwife must recognize signs of distress or complications and respond decisively to ensure the safety of mother and baby. Physical stamina is required in this demanding profession. Midwives often work long hours, overnight shifts, or are on call, especially when attending home births. They must be prepared for physically intense work, including lifting, standing for long periods, or attending prolonged labors. Clinical competence is essential. A midwife must have in-depth knowledge of pregnancy, childbirth, maternal anatomy, and neonatal care. They must also be proficient in using diagnostic tools, interpreting test results, and executing medical procedures when necessary. Emotional resilience helps midwives cope with high-stress situations and maintain calm during emergencies. Supporting families through both healthy and complicated births requires psychological strength and composure. Cultural sensitivity and respect for diverse values are crucial, especially in multicultural communities. Midwives must honor personal preferences, traditions, and religious practices related to childbirth while ensuring that care remains safe and evidence-based. Confidentiality and professionalism are non-negotiable in this role. Midwives handle sensitive personal information and must maintain strict ethical standards in every aspect of their work. Work environment and challenges. Midwives work in varied settings, including public hospitals, private maternity clinics, community health centers, and patients' homes. Their schedule can be unpredictable, often requiring on-call availability, night shifts, weekends, and extended hours, particularly when attending deliveries. The role can be physically and emotionally taxing. Long labor processes, emergency situations, or witnessing pregnancy loss can be challenging. Midwives must manage their emotional well-being while continuing to provide compassionate care. Another challenge is balancing clinical guidelines with personal patient choices. While midwives aim to support natural childbirth and patient autonomy, they must also prioritize safety and intervene when necessary, even if it means overriding a birth plan in emergency situations. Documentation and administrative tasks can also be time-consuming, especially in public healthcare systems with strict compliance standards. Accurate record-keeping is essential for continuity of care, audits, and legal protection. Despite the challenges, many midwives find the profession immensely rewarding. Being present at the birth of a new life, forming deep connections with families, and supporting women through one of the most transformative experiences of their lives offers unmatched personal and professional fulfillment. Educational requirements and career path. Becoming a midwife typically requires a formal education in midwifery or nursing. In many countries, aspiring midwives must first obtain a degree in nursing, followed by specialized midwifery training. Alternatively, direct entry midwifery programs are available, offering a pathway without a prior nursing degree. Midwives must be licensed or registered with the appropriate regulatory body, which may involve passing a national exam, completing clinical hours, and undergoing background checks. Continuing education is often required to maintain certification and stay up to date with best practices. Career progression for midwives includes opportunities to become senior midwives, clinical educators, or specialists in areas like high-risk obstetrics, neonatal care, or maternal mental health. Some midwives transition into public health roles, policymaking, or academic research. Advanced degrees, such as a master's in midwifery or nurse midwifery, can open the door to leadership positions or roles in midwifery education. Midwives may also work internationally with humanitarian organizations or maternal health initiatives. Conclusion. The job description of a midwife reflects a role that is as nurturing as it is clinical, blending science with empathy and skill with humanity. These dedicated professionals guide women through the complex and beautiful process of childbirth, providing not just medical support, but emotional care and empowerment. For individuals who are passionate about maternal health, committed to compassionate service, and capable of navigating both calm and crisis, midwifery offers a deeply meaningful and rewarding career. Through their expert hands and open hearts, midwives help bring new life into the world, safely, respectfully, and with dignity.